At the National Mental Health Commission, we believe all Australians are entitled to live a contributing life where we can be thriving, not just surviving. We have access to effective support and care and treatment and something meaningful to do, something to look forward to have connections to family, friends and culture, and importantly feel safe, stable and secure. Too many Australians are experiencing mental health conditions that are more often than not preventable and treatable. Tragically, suicide is the leading cause of death among 15 to 34-year-olds, and our First Nations people are taking their own lives at a rate twice that of mainstream Australians. Since 2012, the Commission has been working with the mental health and suicide prevention sector, with lived experience, clinicians, academics and service providers to build a system that supports all Australians right across the lifespan. Announcements in the 2019 federal budget reflect the hard work and advocacy of many people working to ensure that the right programs are in the right place and with the right resources and dollars to match. There is much to be pleased about in tonight's budget, but still much to do. The National Mental Health Commission will continue to lead renewal in our sector by focusing on the real gaps that have been identified in our national approach. An integral part of this fresh approach to mental health is the Commission being consulted and involved in the co-design of significant programs. The Commission is committed to ensure that whatever the program, the impact is measurable and the service is delivered to people and the places at most need. There are 4 new key takeouts from tonight's budget where our country's overall mental health and wellbeing will be directly impacted. A real-time account of suicide underpins a renewed, unified national focus, and shortly I will canvass what this means and how it will be utilised. The largest unified Australian government-led national mental health workplace initiative will be priceless for the 12.6 million working Australians and their families. The Minister has also announced a revitalised plan and long-awaited dedicated support for mothers through their maternity journey. And lastly, a trial of 8 hubs for adults with immediate mental health needs based in our communities. All valuable initiatives, promising steps. However, this is an evolving, continuous journey which requires reassessment and recommitment from policymakers. The announcements in this budget need to be assessed against what they mean and deliver for the mental health and wellbeing of every single Australian. And this underpins every aspect of our lives. The Commission is committed to ensuring that Australia's focus on mental health and wellbeing is dedicated to supporting every Australian's ability to live their best life. As the lead agency of Australia's largest collective commitment to mental health and wellbeing in our workplaces, the Commission will coordinate a 4-year program for the Mentally Healthy Workplace Alliance. With funds from this year's federal budget, we have exciting plans. This funding builds on our years of support and commitment from organisations who represent hundreds of thousands of employers and employees. This will provide strong networks and resources for our national workforce to address the critical needs for anyone who experiences mental ill health in their workplace. Tonight we saw real evidence of Australia's commitment to work together to achieve 0 suicides with the investment in the National Suicide Information Initiative, and we applaud the Government for responding to this key recommendation from Australia's first Suicide Prevention Summit in December last year. Funding and prioritising the National Suicide Information Initiative brings to fruition more than a decade of work by many dedicated professionals across the health and justice jurisdictions, and the significant advocacy by parents and loved ones who have lost people to suicide. The National Suicide Information Initiative will nationalise the way in which Australia collects and reports suicide and self-harm data. Its aim is to provide real-time reporting on this data for the sector and for national reporting. Knowing more means being able to be more agile in responding. We can't plan prevention or tweak interventions if we don't have the in-depth data, the why, the when and the where, for instance. The Commission will work closely with the Australian Institute of Health and Welfare, who will manage the significant project, and any barriers in jurisdictions and the various methodology of reporting and collecting data will be addressed. This data will be consolidated from multiple sources and made available through a single portal in real time to anyone. Sadly, there were 3,128 suicide deaths registered in 2017, and suicide is the leading cause of death for people aged 15 to 44. By age, the suicide rate is the highest in our elderly. Tragically, this is higher for young Indigenous Australians. There is so much work to do. The second of tonight's significant announcements is the government's investment in workplace mental health reform through the National Workplace Initiative. This recognises the significance of 15 national, business and mental health peak bodies, unions, regulators and organisations working collaboratively through the Mentally Healthy Workplace Alliance. This program builds on existing best practice resources and tools to help workplaces navigate, develop, implement and measure workplace mental health. It will provide resources and simple practical implementation guides for workplaces to easily access at no cost. Through this, we can profoundly improve the lives of millions of Australians and their workplaces. Workplaces are ideal settings to promote and protect mental health, prevent illness and suicide, support recovery, and increase participation for the many people living with mental illness who want to work. Untreated mental health conditions cost Australian employers almost $13 billion each year. There are $70 billion in costs associated with addressing mental health issues right across Australia. From the beginning, the Commission has called for a whole-of-life approach to the investment in mental health, a redesigned national maternity peer support program which recognises the critical need for dedicated mental health services and support for women and their families during pregnancy, childbirth and with newborns. Support for the 1 in 10 women who experience depression while pregnant and the 1 in 7 in the year following childbirth is crucial to living the best contributing life. The government's further expansion of Australia's Youth Headspace network will see an additional 10 new Headspace sites and 20 new satellite services to be commissioned by the primary health networks. The Commission is mindful of the connections and pathways Headspace centres support in each community and is supportive of rigorous reporting and accountability to track the way in which young people access, use and are appropriately supported into health. It's clear the Headspace network needs to be fully connected and accessible by young people without any delay or barriers and should meet the increasing demand for mental health and wellbeing services by our young people. Anything less and we have failed. Based on the insights that informed the recent reforms to the Youth Headspace network, the government has also invested in a trial of an adult mental health care hub model in 8 areas across Australia. Any evidence-based program that provides Australians with immediate access to psychiatric services in their community with specialist mental health care without any impediment of operating time, resources and affordability is a step in the right direction. Any appropriately funded and resourced mental health initiative which aims to take pressure off hospital emergency departments and be delivered in the community must be applauded. The new Adult Mental Health Hub service will provide a wraparound, multidisciplinary mental health service with the ability to immediately refer to general health and other health services locally. Access to quality mental health services and programs, regardless of your age, postcode, social or financial situation, is a tenet of our health system. Our mental health system needs to address the barriers to access and ensure that affordability and geography are not barriers to wellness. We still have gaps in our current system and inconsistencies in the delivery of connected support to all levels of need. The Commission is determined that all these gaps are identified and rectified. We will continue to work with governments, private and community health providers, the mental health sector and importantly consumers and carers to ensure that everyone, regardless of where or when their need occurs, regardless in what setting they find themselves, has access to all the support and care they need to ensure they lead the best contributing and mentally healthy life possible. We have taken significant steps forward tonight, but there is still much to do. And at the National Mental Health Commission, we look forward to working with you on the journey.